Hi, I'm Frank Dor. I'm a consultant transplant surgeon at the Hammersmith Hospital as part of Imperial College Healthcare NHS Trust. It's a mouthful. Originally from the Netherlands. So preemptive transplantation is really beneficial because you avoid dialysis, and also it's associated complications of dialysis because dialysis keeps people alive, but it also comes with a high cost, because you have a higher chance of dying. In 5 years, this is, sometimes as worse than many types of cancer. And also, people are not quite well on dialysis. But they have good days and bad days, but they have lots of complications and problems, and that affects their quality of life. So not just the length of the life, but also the quality of life. So if you can prevent this step with, for example, a live donor kidney transplantation, before you need to be dialyzed, you skip that step, you skip the complications, and people stay much better. And this is scientifically proven, actually, that there is less risk of dying around the transplant if you haven't had dialysis, and there is less risk of losing your kidney transplant if you haven't had dialysis. So it's quite complex, but these are the major benefits. Yeah, so first of all, making sure that people get referred much earlier than we currently do, because working up for transplantation takes time, lots of investigations, and also finding a live donor is not like asking your neighbor for a cup of sugar or something else. It takes time, and people need time to get around the idea that they need a transplant. And if you pair that with all the talks about dialysis and the choices of dialysis types, they're overwhelmed, they get depressed, and we know this, we learn this from our patients, so it's not my idea, this is the reality. And that's not acknowledged very well. So early talks, early education about transplantation, preventing dialysis, so preemptive transplantation, that's the first. How do you deliver that? And the successes are, for example, from the Netherlands, there's a home-based education system where actually professionals go into the homes of the patients, and they can bring their families, and the patients will have some food, and it's a really relaxed atmosphere. There they get educated about their options and their best options. And we have to be bold. It's not the same to have dialysis versus a transplant versus a live donor transplant. There are things that are better for certain individuals than others. And in general, a live donor kidney transplant is better than a deceased donor transplant, especially if you do it preemptively. So home-based education, and that also addresses inequities that we have, because various groups of people, not just different ethnicities, different religions, but also elderly versus younger, people with different socioeconomic backgrounds, people with different health literacy levels have different access to the best possible treatment, not just in transplant, but it's very, very tangible here in the UK. So you can address that by giving everyone a bespoke interventional program. And the other program that works very well, and I've been involved with as well here in the UK, is specifically, this is from the Black community, a community-based intervention where people who went through the transplant or donation process are actually acting as peer bodies, and they support the particular recipient or the future recipient of a transplant kidney in their journey and making the choices and learning how they could address, asking the question, could you be a live donor potentially, and speak the same cultural language, coming from the same ethnic background and cultural religious background. And this is really, really powerful.